You've heard of H1N1, MRSA, and C. diff. What is one of the things these three things all have in common? Simple hand washing can prevent catching and spreading the disease. Here we are at BS Stables. The smell of fresh country air, clean, vibrant, horse poo. Yes, horse poo. If one worked in this environment, it probably wouldn't be too difficult to convince people the need to wash their hands. I mean, who would wash this and then do this? Not too many people. Pause. I mean, likely you would wash your hands, shower, change your clothes. It certainly would be a good idea before you went and did anything else. Maybe you've heard in the news about the current report from the Canadian Medical Association that there is no evidence that hand hygiene prevents these illnesses. However, one doesn't really need to be a genius to consider that cleaning up this, and then maybe you can tell me that washing your hands after dealing with that isn't going to prevent it, for what's in there, from going in here. A little bit more information on hand washing. The thing is, only about 30 to 40% of all people wash their hands after using the bathroom. These people are in the elevator with us, they're on the bus, they're in the hall beside us, they're making us lunch. Oh, I think I actually might be a little sick. The thing to remember is, hand washing, it isn't brain surgery. In the hospital, we wash before the initial patient contact, before aseptic procedures, after body fluid exposure risk, and after contact with the patient or their environment. Keep it simple. There are a lot of reasons why. Few statistics. C. diff associated diarrhea is a large problem in a hospital environment. Institutional surveillance and independent studies show C. diff greatly increased morbidity and mortalities. It is the most frequently identified cause of nosocomial diarrhea of infectious etiologies. Use of antibiotics is a factor for developing C. diff diarrhea and may occur following the use of any antibiotics. Transfer of C. diff spores via the contaminated hands of anyone working in the hospital equipment, these are the most significant mechanisms of the spread of this disease. Antibiotic-resistant hospital infections kill 8,000 patients each year. 250,000 Canadians become sick from preventable infections each and every year. MRSA alone is estimated to cost $100 million annually. With better control, better hand washing, it is estimated that 30 to 50% of infections would be preventable in Canadian hospitals. Proper hand washing varies from place to place. One study in Montreal found occupational therapists and physical therapists had the highest rate of hand washing compliance, while nurses complied more often than doctors, cleaning staff, and visitors. Now, we're off to the hospital where John will give a little bit of a rant. Here in my hospital, there's been a gigantic push to improve the numbers of contacted C. diff in the facility. All workers have received proper training. There's been a huge increase in the number of posters on what to do, and we've designed this, Canada's first hospital created comic book. And with all these things, we are doing just that. Yep. Audits done at this state-of-the-art brand new facility show that 90% compliance of all staff, workers, and visitors are being done. That is 90% of all people coming into this facility are doing the proper hand washing technique. Now, you might say, John, that's not perfect. Well, that's true. Very, very true. However, when you go from a 30 to 50% compliance in hand washing to a 90% compliance for hand washing, that saves not only those people contacting C. diff, but that saves us time and a huge amount of money being treated with C. diff in this facility. I certainly know one thing, that if I was ill and to be hospitalized for any reason, I myself would not hesitate to come to this facility and be a patient. I know that is an important thing. So how do we do all this improvements? The number one thing, as I've been saying, is hand washing. How do we do this, you might ask me? Well, here we go. First thing to do is to remove all jewelry. That's kind of tough in an environment where mostly women work there. They have wedding bands like this and engagement rings and other rings, watches. That's the number one thing though, remove all jewelry. Then we have to use some water and we have to use a significant amount of soap. It's roughly estimated from 1 to 3 mils of a soap. The toughest part of all of it is this uses time. We are supposed to, for proper hand wash technique, lather for 15 seconds. 15 seconds doesn't seem like a long time until A, you're making a movie, or B, you've got lots of patients and you're trying to get in between one another. So 15 seconds of lather in between. And as you can see, this lather that we use at this facility actually has a time-based element to it. If you do it properly and you use your 15 seconds of time, by the time 15 seconds, the soap has gone from being foamy to being almost invisible. You know that you have wasted your 15 seconds of time. Then, with using warm or cold water, as the data has shown that either is effective, you rinse with running water. You use single-use paper towels. No longer do we use those big rolls of linen that just spins around on the cycle there. We use individual use. You dry thoroughly and turn your taps off with the paper towel and discard. That is the proper technique. With using this technique, we will reduce the number of C. diff cases in our hospital. We have so far achieved that 90%, which is higher than industry standard in most facilities. We will continue to improve on those numbers, and as we continue to improve on those numbers, the cases of C. diff will go back in the tubes where it belongs. Thank you very much.